Hello, I'm John Butler of Hypnotherapy Training International. Our next course coming up in June is Medical Hypnotherapy. I've had somebody this morning ask me, what are the main things you cover in that course? So I've just put together a very quick slide here which gives some idea of this very important application, this part of our work as hypnotherapists. And medical hypnotherapy has been around for about 200 years, and it was started out in the West by Dr. Mesmer. It has its roots in ancient history because people realized the mind powerfully affects the body. It was through healing shrines and healing idols and so on that people often worked in the past. The priests were the doctors. There was a combination of the two. And it was only in the 19th century that the scientific medicine that we know really began to develop, and at that point it began to diverge from all of the old systems of therapies, natural healing systems and so on, and now we're seeing a unification of those in many ways. Now, the first thing to understand is it's based upon the subconscious power over the body, and we know it has remarkable power to help people for healing when it is activated properly. And even if we strip out, which we need to, all of the false claims, exaggerated claims, and the charlatans' messages that are put out there of how to shrink your tumors with hypnosis and so on, if we look deeply into the subject, we still find there are remarkable influences within our mind that can trigger changes within the body, and we need to learn how to use those. Medicine is only in the very earliest stages of understanding those powerful connections, how the mind affects the body for good or for ill. We say your issues are in your tissues. So I'm going to touch on some of those aspects of subconscious influence a little bit further. But we've all experienced times when we felt a bit depressed or negative. Then your energy is low, and maybe then that's the point at which you begin to succumb to a flu, a virus, which normally you mightn't have. So medicine can begin to account for some of that now, because we can see that in a very depressed state, a very stressed state, how the immune system begins to be depleted, becomes compromised in different ways. So the first thing we look at here now at the moment is to understand that your body heals itself naturally. The doctor simply assists with all of our wonderful technology, surgical interventions, all of the diagnostic tools we have which tell us what's gone wrong in the body, and maybe some of the mechanisms led to that. And we look at all the chemotherapy that can be very helpful, but comes sometimes at a great cost. All of that has to work with your natural healing mechanisms. And with powerful hypnotherapy, we're able to assist those natural processes for maintaining our health, safeguarding our health for the future perhaps, and also dealing with illness as an adjunct to medical therapies very often. And a good medical hypnotherapist checks out the full medical history. It gets the medical diagnosis so they know what's going on and how to intervene and work with medicine and work with the body's own mechanisms. So when we look at it, the next thing we're looking at is that in medicine we talk about the biopsychosocial aspects. In other words, it's not just the biological, the psychological influences and the social influences and how those are interconnected, and how they can lead to people being ill. We know that people who are in unhealthy marriages or have difficult problems maybe from their childhood, and we'll touch upon that a little bit later on have a higher rate of illnesses of organic forms, which are physical illnesses. So their bodies are laid open to dysfunctions, so functional disorders as we call them, that don't seem to have a clear organic basis, but may become organic later on. And some conditions which start out as organic, which are genetically based, that are congenital, you're born with them. Nevertheless, how they affect us later and how well we deal with them, the mind and our social influences has a very great bearing on them. So we see that people sometimes when they're physically ill and have to have therapy, how that impacts on their psychological state. Maybe they have to have a mastectomy. Maybe there's other treatments which means they have to have a leg removed or some other major change within their body, and how that affects their mind and their social life, and how that plays back in to the illness, perhaps making it worse, making them more depressed, leading to more illness, and how to intervene in that way. because hypnosis can help people, whether it's to stay on the diet, to give up tobacco, many of those lifestyle illnesses that are often associated with people's socioeconomic circumstances. And for all of our wonderful technology in medicine, what use is it if the person then goes off and makes themselves ill by succumbing to alcohol, excessive alcohol, or very unhealthy eating, or lack of taking exercise? So there's a whole big area of helpful intervention there with hypnosis. And another area is where we're helping people to go through those medical treatments. Maybe it might be something that they fear, having cannulations, having intravenous therapy done to them in some way. Sometimes it's getting ready for surgery. There's a great fear of the surgery. Or it might be just a bronchoscopy, colonoscopy, or some other procedure. It can be very, very helpful for the physician that client knows about self-hypnosis, or the physician knows how to induce trance, or even waking hypnosis, which is done pretty instantly. The trance hypnosis, maybe just 1 minute or 2 minutes, will make all the difference in the world to the outcomes for the person. In other words, in how stressed they are, whether they're able to have that procedure or not. And I've been very gratified over the years that so many of our students have gone out and used it for themselves. And some of our best students have gone out and have used it to help people with very severe dental procedures, surgical procedures, and sometimes with no anesthetic. It's an area where we've done a lot of pretty impressive work over the years, and have people from other schools, of course, but it's hard always to find a very good medical hypnotherapist because it requires devotion, it requires real dedication and practice, practice, practice. So we're dealing then with another stage here, which I've called basically the stress-related illnesses. In the old medicine, it was called spasm illness, spastic colon, or problems with breathing, nervous asthma. Parts of the body going into stress, which causes spasm. Spasm changes affecting arteries, tissues, muscles, for example, and leading to illnesses. So that's a whole big area, which I don't have time to even go into the main points at the moment, but just to know that the main, most powerful form of mind-body therapy is hypnosis. And that's my experience over the years of working with meditational systems and many other systems which very powerfully help the body as well. But hypnosis is the most direct and effective. And we show that with our surgical and other interventions even. We can monitor the changes in the body and see how the mind is affecting the functions of organs and tissues. That's covered in our course in quite a bit of depth. So the next step is analgesia. Chronic pain affects over 20% of people after about the age of 60. And whether it's just arthritis pain or pain from injuries or other problems that they've got, it's very, very valuable to be able to use hypnosis so we don't get people getting addicted to pain-killing medications, particularly opioids, which we now have that opioid epidemic, that dependency and addiction. So more remarkable things can be done provided the client has reached a point that there's no secondary gains, there's no self-sabotage going on here, and they're ready now to learn the tools for reduction and elimination even of pain. And this can be done within surgical settings as well, which we've shown, severe dental procedures as well, no anesthetic even. And that was because it wasn't to show off anything, just to show, though, where the cases that required it. But without that, they wouldn't have been able to have their therapy, the treatment, the surgery. For example, a person with not great health, over 80 years of age, who needs a major medical procedure, the anesthetic may well have killed them. But yet they've been able to go ahead and have the therapy, have treatments, because they were able to use hypnosis with a competent therapist. So acute and chronic pain, very much an area where hypnosis has tremendous value for medicine. And it's only through ignorance and because of the bad press with hypnosis, misunderstandings about it, its poor image and being in the hands of charlatans sometimes, that has put the medical profession off of the idea of using hypnosis, but we now see it being used around the world within various settings, particularly in surgery, as an adjunct or a replacement to chemoanesthesia. Finally, we have this wonderful area here of finding the roots of the medical problem. In other words, the mind has a powerful influence in these cases. We talk about psychosomatic illness, we talk about even organic conditions where the mind has been a powerful influence in setting up the conditions where the immune system is not working properly. Or high stress levels over time have caused a change in functioning of organs, not just blood pressure change, but other changes that have led then to illness and disease. And we can uncover the roots of those problems, so we're not treating symptoms anymore. By just treating the physical symptom, we may well help the patient, but long term, that problem in their subconscious needs to be dealt with for them to get a full, proper treatment and healing from medicine, or medicine may not even be required at that point if we really get to the roots of some of those issues. So this is just an overview of this incredible area of hypnotherapy, the medical application of the therapy, which has attracted the attention of some of the best, most influential people in medicine going back in the 19th century. And unfortunately, it was abandoned for quite some time as a result of Freud and other people who abandoned its use. But now, luckily, in the beginning of the 21st century, we're seeing a great renaissance in the use of hypnosis. And often it's not even called medical hypnotherapy, it's just called mind-body medicine. But as long as you're aware that hypnotherapy, penetrating through the subconscious mind, is really the most powerful way to get the mind to help the body. So thank you very much for listening and watching. I look forward to speaking to you again.